in the ambulance, we take them into emergency, we hand over to triage, and then that patient gets admitted. Can you explain that process of what happens after that?
Yes, there's this saying that the path to hell was paved with good intentions. What actually happens, and it's one of my bugbears coming out of ambulance, where everything was really, well, things were a lot more pragmatic in ambulance. Once we get in the doors of the hospital system, I'm sure some of your students are already working there, everything is very much measured out around a level of risk. So the first thing when we admit somebody is a really big admission process of documentation, searching, using security metal detectors, searching the seams of people's clothing, and it can be quite intrusive to the person at times, but it has to sort of be that way. What happens, I think, is that we have such an exhaustive list of tasks that we start to neglect, or we run the risk of potentially neglecting the way that we do things, not so much as what we do, but the way in which we do them.
That's a very interesting point, because I think that same concept is something that occurs on road as well, in the situation that we get
Absolutely.
so many calls every day, we respond to so many cases. And I will say as well, Eddie, in the time that you've left, the amount of jobs that crews do each day is increased dramatically. So,
Wow.
you know, it used to be that we would get downtime during the day, during the night, but now crews are pretty much pumped the whole time. And
Yeah.
the problem with that is the exhaustion that you get from the clinician. So when you attend cases like what you're talking about, that we
Yeah.
do run the risk of forgetting what the most important part is there.
Yeah. Yeah.
So
Tara,
what
look,
might,
there's,
I was going to say, what might be useful now is what do you think the most important parts, and what are the most important things to address in these situations?
yeah, that's a great question. Look, I think the evidence is starting to mount now that if we focus on how the manner in which we do things, we're likely to get a better outcome.